Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, we have ciliary block glaucoma, also called as malignant glaucoma. In ciliary block glaucoma or malignant glaucoma, actually here in ciliary block or malignant glaucoma, first and foremost, there is if this is the right right in the ciliary block or malignant glaucoma, this is the eye. Now what happens is in ciliary block glaucoma there is aqueous humor will this is the iris. Okay, sorry, this is the iris. Here you have ciliary zonules, this will be the lens. Okay, so this part is the posterior chamber, posterior segment. Actually this is anterior segment till the lens. From the lens to the retina it is posterior segment. Now anterior segment is again divided into, from the cornea to the iris it is anterior chamber, from the iris to the lens it is posterior chamber. Now actually the aqueous humor is present in anterior segment, that is in anterior chamber and posterior chamber. But but after doing a cataract surgery or after doing a trabeculectomy surgery here, or after doing a cataract surgery, removal of cataract, after that the aqueous humor actually which is present in the anterior chamber and the posterior chamber, that is in the anterior segment, it will enter the vitreous. So in the vitreous it is filled with vitreous humor. Actually vitreous chamber is filled with vitreous humor. Now here along with this vitreous humor there is pockets of aqueous chamber will also be seen. So here there will be development of pockets of aqueous humor are seen in the vitreous humor, thus increasing the intraocular pressure, causing the ciliary block glaucoma or malignant glaucoma. So here either after trabeculectomy or after the cataract surgery, there is sequestration of aqueous humor into the vitreous cavity. Aqueous humor will reach the vitreous cavity. This will result in increase in intraocular pressure with shallow or almost absent anterior chamber, because the aqueous humor goes into the posterior segment. Okay, this thus resulting in ciliary block or malignant glaucoma.
thank you and thank you for watching.